It's been described as a failure of epic proportions. In March of 2010, the launch of a centralized pay system for 80,000 employees of Queensland Health is totally bungled.
That's the cost of the disastrous Queensland Health payroll.
Public servants, especially nurses and doctors for close to 200 hospitals, are at a loss to understand their pay slips.
That's one of the letters that I got.
Some are overpaid, others are underpaid, while many are simply not paid at all.
The very first pay was a complete disaster.
Literally, there were people with bags of cash going to hospitals to pay people. It was just chaos.
At the same time, the plan to change the pay system for Canada's public service is taking shape. In August 2010, the Conservative government decides that pay employees will be centralized, an approach similar to the Australian model. Then, in 2011, the Canadian government chooses the same company, IBM, to develop its pay system.
I can't believe that a Google search wasn't done on IBM and payroll, right? Because that would have shown up Queensland Health payroll disaster first up.
Fast forward to 2013, the state of Queensland boycotts IBM. That same year, a commission of inquiry publishes its report on the payroll scandal. Years before Canada launched its botched Phoenix pay system, Queensland State had already learned the lessons from its own and very similar debacle.
I don't know of any worse failure than this one.
The man who led the inquiry says he is astonished that a similar scenario could play out in Canada so many years later.
I must say, I thought that this perhaps was something that could have been avoided by learning from other people's experience.
Before our visit to Queensland Health, only one other visitor from Canada had come calling, Canada's Auditor General. Upon reading his report, the Director General of Queensland Health had an impression of déjà vu.
Yes, we've repeated history. You could almost read the reports side by side and see the same challenges and same things that went wrong.
Nobody at the Canadian government bothered to get in touch with the Australian Health Department that was so painfully hobbled by the crisis. Inevitably, the same errors were repeated.
I'm not aware of them contacting the department to at all, no.
The crisis in Queensland lasted less than 2 years and affected 4 times less employees than in Canada. It ended up costing more than $1 billion to fix. Here in Australia, people fear that the final cost for Canadian taxpayers might be in the billions.
You're looking at maybe $5 billion or more that it's going to cost.
$5 billion and maybe more, according to this payroll expert. That's because payroll for federal employees in Canada is much more complex than in the Health Department of Queensland State. Not only are there 310,000 employees rather than 80,000, and 101 departments rather than one, but also there are 80,000 pay rules that govern Canada's federal workers as opposed to 24,000. In Queensland, getting ahead of the problem meant doubling the number of payroll employees so that data could be entered manually into the system. The inquiry's most damning finding? A total lack of leadership for the whole undertaking.
The major failure was that responsibility on the government side was spread too widely.
For its part, IBM says that the two situations are not comparable and that the sole responsibility for the crisis in Queensland lies with the state. If the payroll issues in Queensland have been resolved for the most part, its after effects have not. Like many, Toowoomba's Veronica Pike still doesn't understand her pay slips from 2010. According to the state government, she was overpaid and they want that money back.
Why should we trust you now when you messed it up so badly before?
A trust so badly broken that years of efforts and hundreds of millions of dollars haven't been able to rebuild. Catherine Lanthier, CBC News in Brisbane, Australia.